In this video I am going to demonstrate how to record an emergency admission for a patient whose name and details are not known. When a patient is presented for emergency admission and they are not in a position to give you their name and personal details, you will still have to register that patient before the emergency admission can be recorded. This circumstance may occur late at night, when there are very few staff available. This means every clinician must be able to do this. The emergency admission must be recorded in real time and not retrospectively. Starting on the floor plan for the critical care unit ward, I will select an unoccupied bed to admit the patient. I will then select Admit in the My Work pane on the left-hand side of the screen. The patient search window now opens. We do not know the patient's name, so I will type in unknown for the surname and forename. In most emergency cases you may be able to identify the patient's gender. If in the event that is not possible at the time, you can choose Not Known. For this demonstration we know the patient's gender. So, I will choose male. When the patient's date of birth is unknown, the date January 1, 1900 should be used. I will type it in. I will now click the Find button at the bottom right-hand corner of the screen to continue. As expected, no records were found for the unknown patient. The dialog window pops up and gives the option to click Yes to register a new patient. I will click Yes to do a new registration. All the information I previously typed in is still there. I will now go to the Address section and select the SFS button to search for the generic postcode for an unknown address. ZZ99 is the official generic code to be used when the patient's address is unknown. I will fill it in now and then click the Find button at the bottom of the screen. I will now select Yes on the dialog box that pops up to confirm it is a No Fixed Abode status. From the search criteria window that is now opened, I will choose the No Fixed Abode entry, and then select the OK button at the bottom right-hand corner of the screen. Sufficient information has now been entered to register the unknown patient. I will now select the Finish Now button at the bottom right-hand corner to complete the registration. An information dialog box pops up as a reminder that the ethnicity, religion and overseas visitors status is missing. This information can be updated at a later date when it is available from the patient. In the meantime, I will click the Cancel button to complete the registration. The Admit window now opens. There are several mandatory fields to be completed. Please also note, the admission date and time are pre-populated with the current date and time. This can be amended if needed. I will start by clicking into the Care Provider field to choose the relevant care provider. If the care provider was not in the list, I would need to select the SFS button to do a search for the care provider needed. I will click into the Care Provider field now to choose the care provider. The specialty and treatment function is automatically populated based on the care provider chosen. The choice for the admission source and admission type must be correct and based on the following information. If the emergency admission is for critical care, primary percutaneous coronary intervention, or emergency transfer, the admission source must be this. I will go ahead and choose it now. Under no circumstances should you choose emergency local A&E. And admission type should be one of the following. I will now go ahead and choose the admission type. The expected length of stay should be entered as 2 days when unknown. I will do this now. Please notice the expected discharge date and time is automatically populated once the expected length of stay is filled in. I will now click the link to create the referral. The Create Referral window is now opened. There are several mandatory fields to be completed. You need to be aware of the correct options to choose when creating a referral for an emergency admission. The choices will appear on your screen now. Please take some time to read them. For this example, I will use the referral details for an emergency admission to the critical care unit. I will display the details again for this type of referral. I will now fill in the details. Make sure the Record Referral Radio button is selected. This is usually selected by default. The Manage Referral window should now pop up and you will notice the referral action is pre-populated as accepted and the current date and time has also been added. The episode name and the RTT intended status has also been pre-populated, so I will now click the Finish button on the bottom right-hand corner of the screen. The referral has now been created, so I will select Next to move on. The allocation window is now opened. Notice the ward details and the bed details are pre-populated. So, there is nothing more that needs to be added to this section. I will select the Next button at the bottom right-hand corner of the screen to move on. And now the Finish button to finally get the patient admitted. The ward floor plan now reopens. The unknown patient is now admitted into the ward. The clinical chart will now need to be created, so I will demonstrate this. Now that the unknown patient is admitted into the ward, there needs to be a new clinical chart created. Starting from the ward floor plan, I will click on the patient in the ward to open the EPR window. The EPR window opens. I will click the Clinical Charts EPR tab. On the left-hand side of the screen, in the Clinical Charts task pane, I will select Create Clinical Chart. To find the required template, I will select the S, F, S button and use the Lorenzo wildcard symbols to do the search. The wildcard symbols are 3 percentage signs. I will type them now. I will select the Find button at the bottom of the screen to display the results of the search. The clinical chart template choices are now displayed. I will select the required clinical chart template, and then, click the OK button at the bottom right-hand corner of the screen. If you are not sure which template you need to use, please check with your line manager. The clinical chart is now created, so, I will click the Finish button at the bottom right-hand corner of the screen. The clinical chart for the unknown admitted patient is now displayed and ready to be used. I will now go back to the ward pegboard view. The icon outlined in red indicates that the clinical chart has been created.
Thanks for watching. If you would like to give us your feedback on this production, please click the feedback icon now appearing on your screen. Thanks again.